Where's my Zoom? Where's my screen? Good afternoon, everyone. Just wanted to let you know we are live on YouTube, so I will be muting everyone until the meeting starts. Good afternoon, everyone. Just wanted to let you know we are live on YouTube, so I will be muting everyone until the meeting starts.
You don't want to hear that. There's always the buffer that YouTube, so you can silence that.
Good afternoon, everybody. I think we are live at the moment, but we're just waiting for just a couple of people to join us. Can I just ask the people who, yes, who are in front of me, that they just come on screen? Thank you. So for those of you who are just in front of me, the people who I can see, can you hear me at the moment? Okay, good. Okay. So to everybody else who is joining us remotely, thank you for joining us. You should be streaming live from YouTube channel, Darian's YouTube channel. And we will give you some directions momentarily just about how to participate in the meeting. But hopefully you're up and running. This is one in a series of meetings that we're holding that started last week to give our community an opportunity to get to know the elements of the plan, to give us feedback, and also to ask questions. Today is specifically planned around health and safety. And there are other meetings planned for elementary this afternoon, middle and high school tomorrow. So hopefully you can join us. Obviously today you're here. If you show wish to join the elementary meeting or middle or high school, we encourage you to do that also. And we'll see you online for those meetings. Today's meeting is really around the health and safety issues. I wanted to share with you that as part of the ongoing discussions we've had from last March, really, but particularly through the start of this year, the school system has worked very closely with a couple of our colleagues in town. One of them is David Knopf. David, people probably know you, but if you want to give him a wee wave there as to who you are. Right there, right. David is our Director of Health for Darien Town, and he has been instrumental in supporting us in our work, and also to work through the various directives, recommendations that we receive on a regular basis. Dr. Kennefack, Tim Kennefack, Timmy, just give a wee wave to people, please. You can't see them, but they'll see you, right? Dr. Kennefack is our medical advisor and has been for some years now, and working closely with Tim and David. We've been working closely with them in terms of implementing our plan, looking at contract tracing, what do we do if under certain scenarios. So they've been tremendously helpful. They've also worked with our staff today, in particular, working through some issues. And I'd also like to introduce, people probably know Alicia Kasuchi. Lisa is our Director of Nursing, but she is also the COVID compliance officer, God bless her. But she does a great job for us in coordinating all of the work, and she has done that since last March. So today, we're just going to go through, I'm going to make a very short opportunity just to share some things with you, because we know that probably most on your mind is, can we get some questions answered, or can we have some feedback on a few things from a health and safety point of view? So we'll work through a couple of weeks slides real quickly. Alicia will work through those. David and Tim will talk about some of the metrics are in there. They will also comment on a few things, and then we'll open up very quickly to questions. If at the end we can't get all the questions answered, we'll come up, we'll share with you a wee process of making sure we're getting back to people. You probably are aware that the Darien reopening site on the website, the portal is open. So we will update frequently asked questions on that site, and some may come from this particular meeting. So just to give you a wee sense, I think people know that we're going back in a hybrid model, and a hybrid model until September 29th. September 29th is really an indicator that, look, that's, if the metrics are what they are, then we are going to go back in that, because the metrics would suggest we could go back full time. The transition that we have in a hybrid scenario allows us to sort of to work through some of the processes. We are in obviously a pandemic health crisis, and we're still in that. Sometimes we tend to forget a little bit, but our kids have to get accustomed to the new practices and routines that they're going to see in the schools. It also gives our staff an opportunity to transition in. It gives us a wee opportunity to look at the policy and procedures that we have in place. And if we need to revise any of those, we can do that before we can come back all in. But our intention is to come back in an all-in scenario person on September 29th. The plan to come all in is also supported by the State Department of Education, and it also has the support of our medical advisor and our health director. So with that, let me share with you just one of the most important things you're going to need to know today. How do I get a question answered? Given that there may be a lot of people on today, we've set up some. Alicia, could you just put up your PowerPoint for me, please? So essentially, at any point during this presentation, you can simply go to reopening@darienps.org and just send a quick email. That will be up live. Mr. Tramberg will have the questions, and when they come in, we'll be able to ask them. We'll probably do this at the end of the process. So that's the email address. Feel free to email at any particular point if you've got a quick question. I would keep it as tight as you can. Would be helpful. And when we get to the question and answer session, we'll start working through those, and our medical advisors and ourselves will answer the question. So with that, I'm going to turn over to Alicia, our nursing director. Hi, Alicia.
All right. Good afternoon, everyone. I'm happy to be here to talk to you about some of the things that we've put into place for returning to school. And I'm happy to have my colleagues with me, David Knopf from the health department and Dr. Tim Kennebec. I would like to thank them for all their help and advice during this time. And so we'll just get started. So again, to submit your questions, go ahead and go to send an email to reopening@darienps.org, and we'll begin taking those at the end. Okay, now I have to figure out, so just a quick brief overview. COVID-19, as we all know, is caused by the novel coronavirus SARS-CoV-2, and is spread primarily from person to person through respiratory droplets when an infected person coughs, sneezes, or talks. Spread is more likely when individuals are in close contact with one another. Symptoms of COVID, main symptoms are fever, new onset cough with or without shortness of breath, new loss of taste or smell, headache, sore throats, nasal congestion, runny nose, or gastrointestinal symptoms such as nausea, vomiting, diarrhea, chills, body aches, and fatigue. In the schools, based on all the information that we've garnered so far, the following mitigating measures will be taken. We'll be requiring those who enter our buildings to be wearing face coverings or a mask. We'll be doing our best to attain a 6-foot physical distancing between students, staff, and between student to student. We'll be implementing a lot of hand washing and hand sanitizing. We'll be cleaning surfaces more frequently and working on sanitizing those as well. And we'll be maximizing the ventilation as we're able to based on our HVAC systems. We are asking, most importantly, that when you're ill or when your student is ill, that they remain home, even if they have mild symptoms, maybe taking the day to make sure that they don't develop a fever or develop any other symptoms will help greatly reduce the spread of COVID in the schools. Just a little bit about face coverings or masks. They help prevent the spread of respiratory droplets to others. They may have some protective value for keeping you from getting COVID, and they're required for all individuals. There will be exceptions made for developmental cases and medical needs, and we'll discuss those individually with families on a case-by-case basis. Face coverings and masks, they need to be at least 2 layers. We're saying no valve or vent should be on the mask. They should fit comfortably and snugly over your mouth and nose. And if you find one that your child likes or that you like, buy a few of them so that they always have their favorite mask on hand with them, and send a couple of extras to school just in case they get soiled or misplaced. It's really good idea to go ahead and start practicing wearing those masks now at home. And, you know, I've been out in the community and different places and seen a lot of small children wearing masks and not even thinking twice about it and not worrying about it. So I do think it's possible to get kids to wear masks without too much complaining. Of course, they always do that more for us than they do for parents than they do for teachers. So recently in the news, they've been talking about gaiters. There's a question whether or not these are an effective way to prevent the spread of droplets. So we're waiting on further guidance from the State Department of Health. And Dr. Kennebec may be able to address that a little bit as well. For the hybrid plan, we are working to achieve a 6-foot distancing in the school between staff and students and student to student. In a full return for students, we will be working to achieve at least a 3-foot distance. So we are working hard to make sure that people are safe. And and that the metrics in the community allow for that 3-foot distance along with the mask wearing. That won't change. Hand washing and sanitizing. There'll be increased opportunities for hand washing with soap and water in the buildings, as well as hand sanitizer stations will be placed throughout the building. We're encouraging you to speak with your children and teach them how to wash their hands, and to discuss with them the times when they should be washing their hands. When we're talking about elementary school children, when they come to school, they'll be washing their hands upon arrival to school, before and after eating, after using the restroom, after recess, and anytime the hands are visibly soiled. At the middle school and high school, students will have the opportunity to wash their hands frequently throughout the day and be reminded to do so with overhead messaging, signs, and verbal encouragement from teachers. We'll be enhancing our cleaning and sanitizing practices in the school. We are trying to avoid the use of any shared materials. High touch areas will be wiped down frequently. Bathrooms will be cleaned twice per day and again as needed. On Friday, we'll be having our remote learning for enhanced cleaning of the building, and you can find more details about cleaning and sanitizing on the reopening pages of the Darien website. Air quality, we've had an independent evaluation of our ventilation systems that started in the middle of July. There will be a report provided as required by the Connecticut State Department of Health. The HVAC systems will be serviced and new filters are installed. The filters will have the highest MERV rating that the manufacturer recommends. All classroom unit ventilators have been serviced with new filters installed and will run continuously. Restroom exhaust fans will run continuously. Window air conditioners will operate in fresh air mode. And all school days will begin with a 2-hour purge cycle of mechanical ventilation systems, and a second 1-hour purge will follow at the end of every day. Exclusion from school. So we are asking that parents and staff monitor symptoms daily. This includes taking a temperature at home. It is really important for the health and safety of all that any students and any staff that are displaying any symptoms of COVID-19 remain home, that they don't get on a school bus, that they don't get in a car and come to the school. Even if it's a mild symptom, we are asking that you keep your child home for the day to make sure that nothing changes. If you need to isolate, that will be when you've been in close contact with an individual who has been diagnosed with or suspected to have COVID-19. So if there's someone in your household who you feel may have the symptoms of COVID-19, we're asking you to keep siblings and everyone home until you know for sure whether or not they have the illness. And we are asking that all families and staff follow the post-travel quarantine orders that were set forth by Governor Lamont. There are several states that are on the list at this point, and so it is a 14-day quarantine. We are not accepting a negative test after coming back from one of those areas to return to school. That is only applicable to people who are essential workers, and there's a list of who those essential workers are, and also for people who are unable to quarantine, which means if you're coming to Connecticut for a funeral or something like that, that you're not able to quarantine for 2 weeks before being in the Connecticut general population. Again, a negative test after travel does not permit return to school. Nurse office visits may look a little different. We are asking for teachers to call down to the nurse office to let them know that they have a student who needs to be seen. There'll be a brief triage over the phone. When possible, nurses will visit students in their classrooms as possible. And also, if a student is ill, the nurse will meet them and escort them to the isolation room so that we are not having 6 students enter the nursing office. We have isolation rooms throughout the building, especially if it's a concern about a communicable disease such as COVID-19. Students will be monitored with a temperature check prior to being seen. This is a chart that explains, it's way too detailed, but it's for this, but just so that you know, if we have a staff or student member who has symptoms, depending on the situation, whether they've been in contact with a person diagnosed with COVID, if they've not had any contact with a person who's been diagnosed with COVID, and if they do not have symptoms, but they've been in contact with a person with COVID, each situation will be treated differently. Those symptoms are feeling feverish, a temperature measuring greater than 100.4 degrees Fahrenheit or 38 degrees Celsius. If they have chills, a new uncontrolled cough, shortness of breath, difficulty breathing, or a loss of taste or smell. If anyone is experiencing those symptoms, they should stay home. As far as contact tracing and communication is concerned, when a student or staff member reports a diagnosis of COVID-19, we're going to work very closely with the Darien Health Department and Dr. Kennefick to be sure that we're tracing all close contacts and notifying those individuals that they need to remain home, be evaluated further, and quarantine. Communication at the classroom, school, and district level will occur as appropriate to this situation. It really depends on what is happening and the exposure level of what we will be doing as far as communication. But you can be pretty assured that when there is a case in the school, we will be notifying the school members that there's a case in that community. And I'm going to turn it over now to Dr. Kennefick to talk about COVID testing and also to talk about the metrics that are being used to determine whether or not it's okay to come back to school.
Great. Thank you, Alicia, for putting all this information together. I know it's pretty dense. But let me start with the slide that's in front of us, which is just some information about COVID-19 testing. There are different kinds of testing out there. Many of you may be familiar with it. There's the testing for the presence of the virus or infection. The most commonly used test right now is a polymerase chain reaction, or PCR. Now, don't worry, there is not a test after this meeting, so you don't have to remember any of this if you don't want to. But that's the horrible swab that goes up your nose and makes you cry. And that is a very accurate test. It's usually done by commercial labs or the local hospitals. Current turnaround time in Connecticut is 48 to 72 hours. I expect that to get worse as we get into the fall and testing rates increase. One other kind of test that is becoming more common is the so-called antigen test. If any of you had like a strep test, a rapid strep test at a doctor's office, I'm sure your kids have, that is an antigen test. Those tests are not as accurate. They have more false negatives and false positives than the PCR test, but they are quicker to perform and will likely be more widely available. They're being approved now. We don't have a ton of data as to their accuracy, but we hope to have more. Now, the slide that Alicia put up before about symptoms, if your child has symptoms consistent with COVID-19, they'll ask to be sent home. And then you have two choices. One is just to wait 10 days, and then the child will be welcome back at school if the symptoms are resolved, which we presume they would. If the child goes to see a healthcare provider and has a negative COVID test, then once the symptoms resolve, like the fever's gone for 24 hours, the child will be welcome at school. Or if the doctor diagnoses a distinct illness, like say strep throat, that's got a totally different treatment, a note from the provider saying this child has a distinct illness that has a distinct treatment or no treatment, with guidelines on when the kid can return to school, the child will be welcome at school. The second sort of tier in that is if that's the stuff I just said, is assuming the child has no known exposure to COVID-19. The other set of parameters applies to kids who have a known exposure to COVID-19. Now, they should not be in school if they've had a known exposure to COVID-19. They should be quarantined at home for 2 weeks. But if a child has a known exposure to COVID-19, testing is not too helpful, because you could test negative on Monday, but be shedding the virus on Wednesday, because the incubation period for COVID-19, the time between when you are infected and the time you develop symptoms and start shedding the virus, is incredibly variable. Children will be asked to stay home for 2 weeks after an exposure. So that's why returning to work is not totally dependent on a test alone. One other kind of testing is the antibody testing, which is testing for past infection. We're gathering more data on that sort of nationally as to what that means. It probably means you're immune, and the data is indicating probably for a considerable point of time. But right now we're not using that in decision making because, again, the accuracy and predictive value of those tests is still being studied. Now, should we move on to the next slide? So decisions on reopening schools and keeping school opens, we're looking at basically two levels, which is sort of the very macroscopic level, which is metrics from the state, county, and town. We'll rely less on the town data, except in very specific circumstances, because the town is too small. So small changes in numbers, because the population is small, can swing significantly from day to day. So we'll be looking at more at countywide or community, regional data. But we look at new cases over the last 7 days, the average number of daily new cases over the last 7 days per 100,000 population. Right now in Connecticut, it's between 1 and 2. In Texas, I think it's 25 to 30. So you can see there's dramatic differences in infection rates and new cases across the country. We'll also look at hospitalization rates and at hospital capacity, because one of the reasons to change to remote learning or to close schools has to do with the general health of the healthcare system in the community, how much capacity there is. And then we also look at local factors, individual cases or exposures in schools, in grades, classrooms, staffing levels. They may dictate changes as well on a very sort of hyper local level. And then there may be other considerations about just the running of the district, again, having to do with the coexistence of other illnesses in town like flu. Most healthcare providers like myself will strongly, I hope I said that enough, urge families to get flu vaccine, because healthcare providers' nightmare is a double pandemic. So any illnesses that can be prevented are helpful. I think we can probably move on to the next slide there. So these are guidelines from the Harvard Global Health Institute, their publications on the path to zero. So these are the guidance they've given us in terms of modifying whether the district would be open or on some kind of hybrid system or on totally remote. So again, right now, Connecticut is hovering right in the yellow or green. Green is safe to open, business as usual. Yellow indicates you might want to move some services to remote. The Harvard group emphasizes the first people who should go to remote learning are the oldest kids. And then sometimes the district can repurpose space to make use for younger kids, because older kids are able to supervise themselves theoretically better at home and are more amenable to remote learning. Not that it's a perfect solution, but it is the solution that most authorities are recommending. And then the in-between cases are sort of in between. Now, some of that is up to the local conditions in the district, but these are based on the sort of macroscopic parameters that we're looking at, which the primary is daily new cases per 100,000 people, which is usually for the 7-day average. But we also look at some of the things that were mentioned above, like hospital capacity, infection test positivity rate, and some other parameters. And David and I look at those numbers very frequently. And they're also reported on a state, and many other websites collate and publish that data. Guess we can go on. So, and here are some of the other parameters that districts look at. I won't walk through everything in this slide. If you're interested, it's easily available online if you Google Harvard Path to Zero for schools. So, and then what's next slide there? So, so yes, I think Alicia's going to show us some of the parameters here.
Get that map the map up so people can see what that looks like if they
Okay.
haven't seen it already, but it's coming.
And while we're waiting, David, did you want to add anything? If you're there?
He might be muted.
We can't hear you if you're talking.
Okay. Tim, I can't improve much on what you said. You did a great job. The only thing that I would like to add is with respect to the nasal swab, it is the most accurate test. And the discomfort, I can tell you from personal experience, is very temporary, but it is real. The antigen test is new and it's not as accurate as you said. DPH is allowing them to be used in calculating COVID positivity because of the rapid turnaround time. And as you said, antibody testing still is not used as a criteria for classifying positive COVID cases. So it's the antigen and the nasal swab that are in use now for testing. And with that, are you ready with the map?
It's coming.
It's coming. We do review the data daily and post it on our website and circulate it to the schools. So we can stay up to date as best we can. As quickly as those results come into us, we post them on the town website.
Here's the Connecticut portion. You can zoom in to your county on the map. So I think at this point, we are probably ready to start taking questions. Chris, are you good?
Can I throw one more thing out there?
Yep.
We know the schools closed in March, and so a lot of kids, of course, haven't been going to school. And of course, a lot of children nationwide haven't been being tested because they're, at very low risk for complications from COVID. So David and I feel it's very, very safe right now to open the schools because infection rates are low, even though we do expect them to go up in the fall. But one thing I really want to say is we are a community. We are all in this together. And up until the start of school, the actions of individual persons and families largely or mostly affect them and their families. The stakes are going to get higher when school opens because the kids are going to be exposed to many other kids. So the behavior of individuals and individual families can have a profound effect on what happens in schools. We're a small town. So if a lot of cases explode because a bunch of children hang out together and one of them didn't realize it, but they were contagious, perhaps with mild or no symptoms, this can cause whole classes to be sent home. So kids could be home for 2 weeks during critical periods of their school because they're not being mindful of their behavior. So I really urge everyone in the community to be very mindful of how they behave and how they interact with other individuals to observe social distancing and other mitigation strategies, because it will not just affect your family, it will affect an entire school, other children and their families. Now your family, parents might not have people at risk, but other children might have family members who they might be exposed to who have significant risk. So we really have to come together as a community and be mindful of our behavior when school is opening, because school is the great mingler, and children will, despite all the strategies here, will be spending time together. So we can't eliminate risk, we can only manage it and reduce it. So with that sermon, I'll be quiet and listen to questions.
Good afternoon, everyone. In addition to answering the questions here, we'll also post them on our FAQ on the website. And whatever we don't get to today, you'll receive a response in email, and we will also add those to the FAQ. The first question is from Karen Cummins, and the question is the hybrid model designed to limit my kids' exposure to each other and mitigate transmission? If so, how is that different from a full 5-day-a-week schedule, given that kids will still be spending full days in classrooms together?
Okay, you want to repeat that?
Certainly. Is the hybrid model designed to limit kids' exposure to each other and mitigate transmission? If so, how is that different than a full 5-day-a-week schedule, given that kids will still be spending full days in a classroom together?
So I can just say from my perspective, the hybrid, while the metrics show that we could be back, I'm not disputing that. The hybrid gives us a chance to transition into a health pandemic crisis scenario, right? Where kids, students are going to be doing things that they haven't been doing before in a school setting, going to learn new routines, new processes, new procedures, masks, washing, distancing. It allows people to come to terms with that a little bit. It allows the staff to come to terms with being more confident and comfortable in the setting also. It allows us to try out some of our processes, make modifications before we transition affirmatively into the full-time model, which was part of the reason of saying September 29th, because it recognizes the data does tell us that we could be back. Yes, we have a bit of a mitigation process in there, but it's also an opportunity to make a soft re-entry and a confident re-entry, and also give a wee bit of a window to see what's going to happen during that time period. And with that, I'm happy to defer to David or Tim if they want to comment any more on that.
Yeah, the hybrid strategy is fewer kids in the building at any given time, and that significantly decreases every child's exposure. So that's the theory behind that. It also gives us a chance to watch rates in the community to see if there is, hopefully not, a significant spike in cases as the town and all the other towns around go back to school.
And it also gives us a chance to evaluate processes and determine if we have to make changes. It's probably easier doing it with fewer students and with the whole school system engaged.
David, we can hear you, but you're just a wee bit faint.
Shall I repeat that?
Morning.
No, you might as well. Yeah, go ahead. Go ahead. Thanks.
Well, it gives us an opportunity to evaluate processes that we put into effect with a smaller group of people rather than the entire school system. So if changes need to be made, we can make them be a little bit more nimble and make them quicker.
Thank you.
The next question is from Elizabeth Pai. Not sure I'm putting the right accent on the right syllable there, but why was the decision made to have children go Monday, Wednesday, or Tuesday, Thursday versus Monday, Tuesday, and a break with Wednesday for cleaning, and then the second half go Thursday and Friday?
So there are different models around our area, and some people doing the break day on Wednesday. First of all, going Monday, Wednesday, it was thought that we'd want to get the children in and not have long periods of time between seeing the students again. Friday was picked as the day primarily. We felt that would be more receptive by parents and accommodating for parents on a Friday. They had come accustomed to that a little bit in the spring session. So we thought that would be somewhat more accommodating. If any of my peers, my principals want to answer otherwise, you feel free to do that.
The only thing I'd add is that on that Friday, it gives you Friday, Saturday, and Sunday for the building to be empty, which is nice, given the respiratory nature of this. And it just lets that air cycle a little bit more thoroughly than one day in the middle of the week.
I can also throw in there that though, as I've said before, cleaning is a very good thing. It's far from the most effective mitigation strategy. It's not clear really whether COVID is spread by infected surfaces. It really seems to be primarily, except in rare circumstances, spread person to person. So disinfecting is helpful. I can't see how it would hurt unless it's overdone. with chemicals that are not good for people, but the district has been very careful in choosing chemicals as recommended. So just time alone disinfects the building. 24 hours is reasonable, though the virus has been shown to live for longer periods on certain kinds of surfaces. It's not clear that any infections have been spread that way. The most important mitigation strategies are still distancing, masking, and hand washing. So other factors come into play with scheduling too, especially with young children. You know, how does it impact their learning to spend long periods without sort of physical contact with the teacher, especially when they're young. So there's sort of many factors that play into it. Also, there's really not much data as to what's the safest and most effective schedule. So different districts are trying different things, and to see whether there is in fact a difference or not. Because school was not in session during the rise of the pandemic, we really don't know. So we're surmising what the effective strategies are, and we're trying to implement them. But there isn't actually a lot of data around that.
Okay, the next question is from Carl Pombar. Given some one-way direction hallways in some schools, Darien High School, and some other unusual traffic patterns, how will emergencies be handled? What if the kids need to evacuate the school in a real emergency? What do evacuation or shelter-in-place procedures look like given social distancing?
I think you're muted.
So the answer to that is that we are reviewing our plans now as sort of last step in the process. And we've had a conversation with the police department, but we will bring them over to review any revisions. The State Department of Education still requires you, and you would expect us to. It's our number one priority, student and staff safety. But those are processes that will be finalized over the next week or two before we go back to school.
And the next question is from Sarah Parent. One of the most prevalent conversations in our community is what happens when there's a positive case in a school. Who must quarantine? For how long? How will those students in quarantine access their education? What are their metrics for when a building must close entirely? Is it possible that you could close one school but keep the rest open?
I don't know if you want me to, or Alicia. Basically, exposure on this level is somewhat microscopic, so we really have to look at who the child was exposed to. The Center for Disease Control defines exposure as within 6 feet for more than 15 minutes. So that's what we're looking at. Obviously, that's, you know, if you're 6.1 feet away, you're not 100% safe. And if you're only there for 14 minutes, you're not 100% safe, but it's the guidelines that we'll be using. So anyone who is exposed by those criteria will be quarantined for 14 days, because that's the current recommendation. So you can see how the impact of one sick child going to school can affect a class, because in elementary school, that could mean an entire class going home or an entire bus, especially if kids don't adhere to their assigned seating. So it'll really be on a case-by-case basis. As for schools, yes, there, you know, lots of cases in a school, lots of staff absences in a school could cause a school to close. Other issues could. So I couldn't possibly list sort of all of the, you know, the scenarios. But yes, one school could close and the others could be open depending upon local conditions there. And I think I might have missed one part of the question, which was not strictly medical. I think it was how would you be notified? I presume you'd be notified directly by the school. There are some privacy issues, so we don't want to, you know, people who have illnesses are entitled to privacy. So the amount of notification will, you know, guard families and individuals' privacy. So people who need to know are told, but not necessarily people who want to know. but that's a guideline for sort of privacy and sort of medical issues.
So just as these issues come up, Alicia, David, Tim, and I will be in close discussion about each sort of incident and what the step is that we need to take moving forward. But the answer is perhaps all of the things you mentioned, sir, could happen.
The next question is from Jessica Shu. I'm wondering if there is a recommendation on keeping children home if a family member or people within the home is sick.
There's a couple levels to that question. If you strongly suspect your child has been exposed to COVID, if you have a family member with symptoms very consistent like that, the prudent thing would be to stay home because you don't know, for instance, children may have very few or minimal symptoms and be contagious, and you don't know whether that the other family member and the child were exposed at the same time. So therefore the child could be ready to display symptoms or infection. So the prudent thing would be yes. Another issue, which may not be the intent of your question, but if there are family members that have significant risk factors, that might be a reason why a parent would choose remote learning as opposed to in-person learning. Not that it's a significant risk to the child, but they don't want to put other members of the household who might have more serious risk factors who can't be, distanced or isolated themselves, from the child. That would be a very valid reason why parents would choose to keep their kids home for an extended period and opt for remote learning.
Thank you. Next question is from Cynthia Adams. Will HEPA filters be placed in the school classrooms? What will recess look like? And will movement within the classrooms be restricted? What will learning look like for elementary school?
I think you're muted again.
Dr. Hadley, you're muted.
Oh, sorry, I just asked one of my elementary principals just to talk to what the elementary day will look like, so to speak.
Well, so this is a nice opportunity to plug. At 3:15 today, we have an elementary discussion where we'll get into more detail about the day, the schedule, and so on. But at a high level, we're going to adhere to all the social distancing guidelines and the CDC recommendations. There's a question inside there about recess. We're going to be very mindful about the location children have access to in our fields, making sure to try to keep those classes together as much as possible, but still have kids have the opportunity for 6 feet distancing so they can take mask breaks and have some fresh air outside. The schedule itself, when students are in the day, will be compressed in terms of the curriculum that we're working that through to give ample opportunity for us to have safe procedures for students to come in and by cohort right to their classrooms, have opportunities for students to practice those good hygiene recommendations that all of our fine medical colleagues are recommending to us. And at the end of the day, to make sure that we dismiss in a way that's orderly and safe. So the elementary model will reflect the CDC guidelines and the guidelines from our local health experts. And then for more detail on exactly what it will look like and feel like, please join us at 3:15 today on this very YouTube channel.
So essentially your learning program is going to be times of direct instruction through streaming into the classroom and opportunities throughout the day for students to be independent and work as well, a combination.
Yes.
Chris, I feel as if there was a third part to that, was there?
Yeah, there was a question on HEPA filters in the schools and classrooms and recess, but I think recess was touched upon, so just the filters.
Richard, do you want to just talk about kind of how we're doing the air quality and filters and so on?
So the air conditioners have the highest rated MERV filter that can go in each individual unit depending on the unit, but they're not HEPA filters. So they'll range anywhere from MERV 8 to MERV 12 depending on the location.
Okay, the next question is from Makela Atenito. And what is the plan for lunch if the students are eating in the classroom and are only 3 feet apart, but unable to wear masks while they are eating? How will the students be protected? And same question regarding snack.
So when we're in the hybrid model, that is a wee bit easier, understandably so. When we're not, yes, it's sort of a minimum of 3 feet apart. I will say we're continuing to work at that for the full re-entry. If there's ways we can increase that. But in absence of that, we're just we're going to have the students themselves are just going to be sitting at least 3 feet apart. The staff are going to try to distance themselves as best as possible. And also do PPEs, the inclusion of additional PPEs, and students, the frequent washing of hands and so on and so forth. That, I mean, it's not a perfect scenario. I don't know what a perfect scenario is, but it's not a perfect scenario in that regard. But through the practice, we'll do the best we can through a variety of practices to mitigate the situation.
Thank you. The next question is from Carl Pombar. Any discussion on banning phones, especially at Darien High School, given the very unhygienic nature of phones?
No, I can honestly say I haven't had a discussion about. Alan, are you laughing behind that mask?
I might be.
I haven't had a discussion about phones, but yes, things like phones tend to. Yep. Those are things we touch all the time, but I honestly have not had a discussion about phones.
Well, as long as you keep your phone to yourself, it's not a huge issue. Hopefully they're not sharing phones, really sharing other things, but not phones. And the issue with objects are if the kids are very mindful, I think I said this to some of the faculty and staff, it's a new normal. So, you know, as healthcare workers, we become in the office very mindful about what we touch and you know, try not to touch ourselves, like our faces and our eyes, and are mindful of what things in the environment we touch that we really don't need to touch. So kids becoming more mindful of that is very helpful. They'll need you to teach them that. But with frequent hand washing and face coverings, it really decreases the risk of transmission because typically the virus is carried from objects to the mouth and nose by hands. And if hands are clean or are not touching the face, then that route of transmission is interrupted. Again, the primary way of spread, we believe, is from person to person in any case, and much less so through objects.
A year ago, our big concern was vaping. So one of the things that we need to do is to make sure to tell the students that it's not okay to share your vape with anybody else. That's a problem. That's
and vaping
will transmit.
And vaping use has been associated with increased risk of more serious COVID disease. There's just some recent data on that. Not that it's ever a good idea.
And the next question is from Lara Doggett. I know there's an attendance survey due today by 4 p.m., but based on what you know so far, what percentage of students will be participating in e-learning only and not returning to school? And then when can I get a figure updated based on the results of today's survey?
So there's about, our understanding is about 93% of the student population, if I'm understanding the question correctly, are coming back as of sort of today. I'm going to let the survey run out through tomorrow. I know we said Monday. I'm going to let it run out through tomorrow because some people, I think, would like to see today's presentation, this afternoon's presentation. There's middle school and high school presentations tomorrow. So I think we're going to close it out at the end of the day tomorrow, just for those people who would like to see those presentations in advance. But right now it's, we're talking about 93% of the student population returning.
Next question is from Daniel Buke. How will keeping a child home due to possible illness, etc., affect the absence policy? In other words, will playing it safe count against a family and be counted on the child's record?
I would say no. Right. For the most part, no. For the very most part, no. Right. Let's call it a no. We just can't keep a child out for no reason, clearly. But if it's a health and safety matter, then clearly we're in a health pandemic here. the State Department has indicated you're allowed to keep your child out, regardless of whether they're sick or not sick. So we'll be reviewing the attendance policy again, but it's we're not going to be holding people. We're not going to be holding people to that type. We have to hold it at some level of attendance, right? Some reasonable level of attendance. But if you've got health and safety issues, we understand that. We also, like the start of the year, there's always bus issues too, right? And there's going to be more bus issues this year in terms of the start of the school day. So we're not going to be holding kids tardy, they're getting into class a wee bit late to start with, and so on and so forth until things slow down.
Can I'll add to that. So any student who is called out sick, the nurses will be following up with those students to find out about symptoms and things like that, so that we'll be able to have a better handle on, why your student is out, and if we are seeing an uptick of symptoms in the community, even if we're not seeing, necessarily a higher positive test rate, but that way we can keep a pulse on what's happening in the schools as far as illness is concerned. And by documenting that information, it will really help with our, probably any issues around attendance. So by having it documented that way, it helps prevent, being concerned about students being absent for extended periods of time without any information about that.
Thank you. The next question is from Jamie Stevenson, First Selectman. Are teachers, paraprofessionals, administrators, coaches, nurses, and other school staff considered essential workers?
Well, I would have to check the executive order to see if they're actually essential workers, but to me they are in terms of working with children. But if there's a technicality that I need to check, I'll take a pause on that just to check it. But
yeah. The next question, I don't have a full name, I just have Schultz. It's a series of questions, and I'll do the first one and then move on, as several people have a series of questions as the meeting has gone on. The first question was, we'd like to know if DPS will provide and require COVID-19 testing for all teachers, students prior to entering any of the school facilities. Our neighboring district in New Canaan is doing this, as is Yukon and many businesses, to ensure their employees are safe before coming into contact with others again. If not, why not? How do we justify not testing when this has been identified along with contact tracing as the best method to ensure safety? If yes, where, how, when will this be done, tracked, and maintained?
so we have had that discussion, and we have landed where we've landed, and I'll ask Tim or Dave just to fill us in why.
Sure. Actually, the CDC is not recommending that just because there's no data to show that that's helpful. The reason is in certain universities that can isolate and bubble sort of their students, where everyone comes on campus, is tested when they arrive, if they're positive, they're put in a dorm for 2 weeks with other positive kids. The idea is there to create a safe bubble. Unfortunately, with the community school, you can't do that because the kids are not in a bubble when they're not in school. So actually, most of the time, they are out in the community. So you can test negative on Monday and you can be infectious on Tuesday. And particularly in asymptomatic people, the sensitivity of the test is low. The other thing, for those of you who are epidemiologists, the value of these tests often depends on the pretest probability. Right now, the test positivity rate in Connecticut is hovering around 1%. And even if you have a test that's 99% accurate, a substantial percentage of the positive tests we will see under these circumstances will be false positives. Now, you would think that false positives are innocuous, but they're not, because then people believe they've had the illness and may choose not to undergo mitigation, which may put themselves and other people at risk. So mass testing and screening in times of low infection rates don't necessarily help the community and may just serve as a barrier for kids accessing education. And they provide only safety for those first few days. And once everybody's back in the community, nothing changes unless you're prepared to do that on a day-to-day basis. And in a perfect world, if the country had that kind of testing capacity, that would be a great idea. But daily testing, particularly swab testing, would be asking an awful lot of our young students. So that's some of the reasons why the district has chosen not to do that.
We don't have the capability of doing that amount of widespread testing, first of all, and there's little value really in testing asymptomatic people for the most part. As Tim said, you know, negative one day doesn't mean you're going to be negative the next.
Dr. Hadley, I'm just noticing it's past 3 o'clock. We have about 40 questions remaining in the queue that we have not answered. And there's also an active YouTube chat where there are additional questions, which we'll capture and address for the FAQ. Would you like to take any more questions now? Sorry, you're muted.
Let's take a couple more questions. Those that remain, we will make sure that whatever the source is, we'll get back to those people, and we'll also add them to, if it makes sense to add them, we'll add them to the frequently asked questions on the website as well, but we'll certainly get back to the individuals who are asking the questions.
Okay, the next question is Christina Baudu, wondering if it would be possible to offer students, especially those at elementary schools, a virtual walkthrough so they can visualize what entering the school will look like, what a classroom will look like spaced out, and with the plastic separators, etc. It could go a long way in easing nerves for students to understand how things will be the same and different.
I'm happy to take that. Yes, we do have plans to do that once our classrooms are set up.
There's a question about masks and how will mask wearing be enforced? Will children be sent home if they don't follow the mask rule? Sorry, this is from Wojciech Wolski. And when will kids be able to take off the mask that will be considered safely?
So I'll answer the first question, probably along with Alicia, but ultimately, I mean, some students are going to have a wee transition to come accustomed to some of this, but ultimately, students are going to have to wear masks because we're compromising the safety of everyone, themselves, other people. So the answer to that, yes, they're going to have to wear masks, and yes, invariably, inevitably, if they don't wear the mask, they're not going to be they can't be in school. So that's really the answer there. And then the breaks are being designed. Our principals are designing the mask breaks throughout the day in different locations in the building. I don't know if that summarizes it too quickly if anybody else wants to take that part of it. Okay, all right, that's it.
This is from Aaron Lumpkin. If the local infection rate goes up, would the district consider testing? While it won't catch all the positive cases due to the nature of the incubation period and testing accuracy, even if it catches one case, that would reduce the potential exposure to other students and the staff.
So it wasn't on my horizon to do that, but again, I would take direction and be informed by our health professionals on that. But I didn't think that was part of the mitigation strategies if the rates increase. But again, I can defer to my colleagues here.
If rates increase, we might be able to expand the drive-through test facility that we have in town now to provide additional testing capacity. They've just changed their operational procedure to enable them to take appointments, and I believe they're able to take appointments every 5 minutes. So we can see how things happen going forward and maybe utilize that as a method of providing broader access to testing for the community.
Yeah, one of the issues we faced as a pediatric healthcare provider is testing younger children. up until very recently, it was very hard, if not impossible, to get testing except in the emergency room for young kids. Now there is some of that capacity in the community, though it's limited. Children have always been a low priority for testing just because the risk to them is so low. It's really the risk to the community and staff that's represented. Now, as some of the newer tests, I think I mentioned the rapid antigen tests come into play, that might increase the availability of testing. They have a significant disadvantage, though, as they're much less useful in people who don't have symptoms, because their ability to turn positive depends on the amount of virus present. The PCR test, which is the standard right now, can detect very, very minute quantities of the virus, whereas the rapid antigen test cannot. So until there's some data on the usefulness of that screening, we don't really have any data that shows that that kind of test is useful, particularly in children who may be asymptomatic. So we'll have to wait to see if there's more guidance. My concern is that testing capacity in the United States is already limited, and they're having struggles with turnaround times. And as viral rates rise, the priorities tend to shift to older and people at greater risk. So unless there's a dramatic increase in testing capacity in our nation, which is a whole nother discussion, I don't know that that's going to be feasible.
Would you like another question, Dr. Adley?
I think that's very, very respectfully to people will have to be the last one. You can stay on now, yeah, you more or less stay on and roll into the next meeting if you're so inclined. But we'll take one more, and then the other ones that are there, we'll respond to the people in kind, and again post on the F&Q section of the website.
Okay, this one's multi-part, but I'll just give one part of it. This is from Laura Pesh-Gray. If fever is one of the main concerns and symptoms of COVID, why can't schools simply do a thermal check? Parents may be taking temps an hour or longer before arriving in school. Many things can change since the temperature was taken.
I can address that. It's another thing the CDC doesn't recommend, because though it's good intentions, the actual application of it in places like schools where you have everybody arriving at the same time often means you actually end up bunching people up and closer together, unless you get certain kind of technology, and it may not be as accurate in children, particularly in the wintertime. Really, the parents should be screening for symptoms at home and not sending their children if they're sick. But lining kids up or to take their temperature probably puts them at greater risk than letting them in. The other issue is temperature in children in particular is not always the best marker for COVID infection, unfortunately. I mean, it's definitely a reason for exclusion from school, but screening for temperature will not, by no means, identify everyone with COVID, every child entering the building.
Okay, with that, our time is drawn to a close. Again, I want to thank people for their participation. We'll continue to have forums as we feel as if the community would like to have forums. We'll complete it again today with the submitted questions that were unanswered to get an answer to people, and again update the Q&A website. With that, I know several of my colleagues are going to be joining me in another meeting very shortly, but I thank the parents for joining us on YouTube Live. Thank you for your participation today. Thank you for your ongoing participation, because I said this is a community-wide thing. What you do affects the schools. What we do affects the home. So working collaboratively and partner together over the next couple of weeks and months ahead is going to continue to be critical. So in advance of that, we thank you, and we'll be sharing information with you that you can communicate to your children in advance, and that will also be appreciated. But for now, we're going to sign off, and we thank you for your time today. Thank you very much.
Thank you.
Thank you.